I'm age 69. For the first 33 years of my life, I was well, strong, healthy, active, very fit. Only had 2 visits to hospital, and they were for the birth of my son and my daughter. I did not have asthma as a child, so it was adult onset asthma. And the reasons why I had asthma were not well known at the time. And the treatment was what I would now call fire brigade treatment. It was, trying to treat the symptoms, but not to find the cause. So right through my working life, I became more and more affected by the asthma. The outcome was that it gave me a little bit more control in managing what was going on with my asthma. What they also gave me, which was particularly significant in my case, was they gave me a list of medications that were contraindicated for someone with asthma, particularly if it was allergy related. So this was also a big help, because I know myself I had adverse effects to medication in the past, in particular anti-inflammatories and ibuprofen. And of course, they were on the list. Now, during that time, I became aware that there was a whole lot more going on about how asthma was treated and managed, and that there was research going on, and it was possible for patients to be involved, as real people, and not just as subjects, but as somebody with a voice and an opinion, and could speak about their experience and their symptoms and how they related to life in general. I was literally struggling to live. I phoned the nurse in the Asthma Society and I said, I can't live like this. I need to get this checked out. I think there's more, and I think there's something being missed. So she sent me to Professor Stephen Lane in Tala Hospital, and he did a number of different tests, and over the period of about 2 years, he eventually concluded that I had severe allergic asthma, I had bronchiectasis, and I was an alpha-1 carrier. There's no excuse now for people not to get an earlier diagnosis and certainly a more personalised, the right medicine for the right patient at the right time, or the right treatment for the right patient at the right time. The doctor needs to ask the right questions, and then needs to listen very carefully to the answers. So taking a history is essential, and taking time. Now, again, I know that, say, people, particularly in primary care, they're pushed for time, but often there's a nurse that's also attached to the practice, and the patient gets more time with the nurse. And I think the asthma nurses have a huge role to play here, and there's no reason why they can't assist. If the communication is useful, if it's practical, if it's designed to not just make me feel stupid or useless, it's to empower. I think the communication needs to be very clear about, and if there's something that they think is missing and that needs further investigation, it's okay to tell me that. No two people are the same. So to always bear that in mind, that, you may never have come across an individual like the one that's in front of you. So to treat that person, as an individual, because their story and their experience and their set of circumstances are very different to anybody else that you've met or that you've seen before. So I think not to forget that, and also I think to remember that the patient is your partner, and the two of you working as a team can sort this and find a solution.